And good morning, everyone. Welcome into a brand new edition of Sports Medicine Weekly. So happy you're with us on this Sunday morning. Steve Cashel with you, along with my co-host, Dr. Brian Cole. He is the head team physician for the Chicago Bulls and one of the team physicians with the Chicago White Sox, a sports medicine specialist, orthopedic surgeon from Midwest Orthopedics at Rush. Our website is sportsmedicineweekly.com. Reminder, folks, that podcast segments are always available to hear on our Sports Medicine Weekly blog, also through Apple, Google, Spotify, Pandora, YouTube, and iHeartRadio. Dr. Cole, how are you on this Sunday morning?
Steve, I'm doing great. Thank you. Hope you're well as well.
Well, yep, and the big topic continues to be the coronavirus, COVID-19, and something that has kind of hit the athletes, not all of them, maybe a very few number, but it is obviously raising some alarms, is the myocarditis. Can you tell us and simplify it for our listeners of what that is and how it's affecting those who may get COVID?
Yeah, Steve, COVID has had lots of effects, and it's the obvious that people think about, which is, aches and pains and fever and cough and so forth. But it is especially associated with what we call cardiorespiratory problems. And this is really important when we're talking about return to play for sports for our elite athletes and even those that are younger, going back to the high school or college setting. So one of the challenges with COVID is it's associated with a significant inflammatory response, and that in and of itself can have a impact on the heart. Patients can complain of chest discomfort, shortness of breath, tachycardia, which is a rapid heart rate, and just the effects of the disease can lead directly to, say, heart and lung issues. But there's also this condition that you alluded to called myocarditis, which is inflammation of the heart muscle, and it can lead to heart muscle death, really akin to a myocardial infarction or a heart attack. So most heart attacks happen because of blood flow problems, the so-called atherosclerosis or coronary artery disease. These are young people who are getting heart muscle death because of the inflammation in the heart and reduced cardiac output. In other words, the function of the heart decreases. The good news is a lot of it is reversible, but certainly if there are large areas of cardiac death, that is not irreversible. And the challenge is that it may not be known to the athlete how significant it is. Certainly any athlete that's having symptoms such as shortness of breath, significant fatigue, tachycardia, rapid heart rate or regular heart rate, chest pain, chest tightness, chest discomfort with deep breath, all of those things need to be on their radar, because this is one of those things. I don't know if you remember the Hank Gather situation where, sudden death is when the heart undergoes an arrhythmia where there's an electrical abnormality, and that's something that is potentially avoidable if the athlete's evaluated properly. So we're very attuned now to taking history to see if our young athletes have had COVID, and if they had and they're not symptomatic but they're coming back to a high level sport, their medical physicians might recommend an EKG, may recommend a stress echo, might even recommend testing for a protein called or an enzyme called troponin, which is an enzyme from the heart that can be elevated in the setting of myocarditis, and sometimes even an MRI of the heart. It's less likely they'll need all of that if they're asymptomatic and don't have those symptoms. But Steve, if they've had significant symptoms at all, this needs to be evaluated. So this is a new complexity, and it's especially important in the area of sports medicine and our young athletes who are trying to return back to play.
And Dr. Cole, specific on baseball now, White Sox third baseman Yoan Moncada has told the media that he hasn't felt the same after having the virus, and he says he feels a lack of energy and strength, just a weird feeling. So he's still playing at a very high level, but boy, there's an incident right there of one of our local athletes who had the coronavirus and is playing Major League Baseball right now, but he's obviously feeling effects.
Steve, the challenge is that people say, well, I don't know anyone's gotten really sick, or I don't know, so-and-so is not going to die because they're less than 60 and things like that. But I would still argue that you just don't want to get this if you can avoid it. And I've often said, just because you're tired of it doesn't mean this thing's gone away. And this is a great example that the after effects can be tremendous in some people. And I've talked to a number of people who say, look, I just don't feel right. I don't feel normal. I don't feel like myself. And they're just battling this issue of low energy and strength and malaise and appetite and fatigue, and they just don't feel themselves. And hopefully this is not going to result in long-term effects for the vast majority of people. But this thing can be prolonged. You may not be contagious after 14 days, for example, but you certainly can have symptoms that can go on for a extended period of time. So I encourage everyone to understand that, again, being tired of this does not mean it's any better, and we can't let our guard down. You just don't want to get it if you can avoid it. We're hopefully coming down the towards home plate, if you will, in terms of getting a vaccine at some point in the next couple of months. So all of us have to do our best to try to stay healthy.